Hi, this is Tori Novak, respiratory student with Southeast Community College. I am here today doing my midterm skills assessment. I will be turning this in 3 videos. I am using the PFT room in the older part of the hospital, so I don't have access to like an air outlet, and I also don't have access to a regular mannequin, so I'm going to be using like a mask mannequin, but I'll do my best to talk my way through these procedures. And so I'm going to be turning this assignment in 3 videos. First, I'll show you how I perform my oral cares and my cuff pressure checks, and then I'll show you a video with my Drager 500 for my invasive. I won't actually have it hooked up to an intubated mannequin because I don't have one, but I will still try to talk through it and demonstrate it as best as I can to you. For my non-invasive ventilation, I will use the V60 BiPAP, which is the machine that's used here at my clinical site, and I will go ahead and apply the mask to my patient, but I will attach my lung to the circuit so you can see actually what it's doing. I hope that will be acceptable. That's the best that I can do at this point. So I'm going to go ahead and get started. And so anytime that you are going to perform any cares for your patient, of course you need to knock before you enter the room, introduce yourself and your department. You need to wash your hands. You need to assess the patient from the door, and then you also need to get an up-close assessment as far as their vitals and their breath sounds are concerned. You always need to apply the appropriate PPE for the situation that you're in and go from there. So for me, if I was going to be doing, well, I'll just start with oral care. So I'll kind of do this so you can sort of see what I've got going on. My patient would be laying down. So I've come in, I've introduced myself. This patient has an ET tube in for, I don't know if I can just kind of set it up like this for the sake of the video. So I've come in, I've washed my hands, I've introduced myself, I've got my gloves on, I've gotten the vitals. So I come in, I want to check my patient's overall appearance and vital signs. Then I want to look at the integrity of the skin that's around the mouth. And of course I have gloves on because that's the appropriate PPE for this particular procedure. So I've come in and I'm just checking that skin. I'm looking for any wear and tear that might be on the tube. So then we're going to go ahead and start oral cares. So you do the oral cares every 2 hours, and you do these cares to help prevent any ventilator-acquired pneumonia from happening with these patients that are in fact intubated and on the ventilator. So the first time you come in, you'll use this particular attachment, and this side hooks into the wall section, -100 to -120. So we're going to have gloves on. We're just going to go ahead and pop this on there like that. It's hooked up to the suction, and we're going to go ahead and just suction the inside parts of the mouth into the cheeks and down where the secretions are probably just setting, and that patient's not able to get rid of them by themselves, so we're just sucking those secretions out for the patient. We can kind of move the tube from side to side just so we're getting that in there, and then we do cover this up because we don't want it to get dirty or anything like that. And so after we've done that, and we're ready to come back again, it's been 2 hours, it's time for our next oral cares. Then you attach the toothbrush piece, which I don't have. I did not get that in my kit, but it comes with like a toothpaste type of solution. So you'll go ahead and attach the toothbrush. It's still attached to suction. You're going to get some of that toothpaste on there, and then you're going to actually brush the patient's teeth. So you're going to get, the bottom teeth all the way to the back, the front teeth all the way to the back. You want to get the fronts and the backs of the teeth, all surfaces of the teeth, and you want to be gentle, but you don't want to be so gentle that you're not getting the mouth clean, but yet if you're not thorough enough, you're not doing the job you need, but if you're too rough, you're causing pain to the patient. So you don't want to do either of those things. So once you've gotten all those teeth, you want to get the roof of the mouth, the gum line, the tongue, the teeth. You want to get that all brushed up and clean. That way we are, in fact, reducing the likelihood that your patient is going to get the ventilator-acquired pneumonia. Then you can turn the suction on. So when you're brushing the teeth, there's no suction. Then you're going to turn the suction on, and you're going to suck out any of those secretions that are left in the mouth from that toothbrushing. And then after you do the oral cares, you're going to use a little bit of mouth moisturizer, and you're going to put it on this green swab. And this is safe to be on the inside of the mouth, so you're going to get the inside of the cheeks, the roof of the mouth, the tongue, along the gum line, and you always want to make sure you get the patient's lips. So that was our oral cares for the second time. Now we come back again. It's been 2 hours. It's time to do some more suction. So the next thing that we're going to use is this longer suction catheter. And again, we're going to hook it up to suction. Now my ET tube isn't going to want to stay. Sorry. Okay, so with this, we're actually going to be able to get farther back down into the throat. So we're in the mouth, but we're getting farther back in there by the ET tube. These patients aren't able to, so it'd be kind of like we're getting back here. These patients aren't able to cough up and expectorate that, so it's just sitting there. That's what our job is to get that out of there so that we're not going to have any type of, that gunk that's sitting on top of the inflated cuff. When we deflate that cuff, that could fall in there, and that's how those patients could get that ventilator-acquired pneumonia. So it's important that we do proper oral cares for that reason. So once we've gotten them all sucked out on both sides, deeper down in the throat, we come back. It's been 2 hours. We're going to do our next round of oral care. So we attach this. It's like another one of those bendy things. You can see there's kind of a hole in the end where the suction goes. This is a lot like the toothbrush. So we have this it's almost like a mouthwash. It's called oral debriding agent. You're going to dip that in there, and again, you're cleaning all the internal surfaces of the mouth. You want to get the cheeks, the gums, the roof of the mouth, the tongue. You want to get on both sides of that ET tube and really make sure you're getting that mouth clean. And again, when you're doing the cleaning, you're not using the suction because you're sort of counteracting it if you are. So once you've gotten the mouth all clean, and then there's going to be a buildup of secretion, turn on that suction, get all that stuff sucked out of there. And again, when we do oral cares like this, we always need to moisturize the mouth. So you're going to put this moisturizer on the swab, and we're going to go ahead and get the lips. We want to get the roof of the mouth. We want to get the tongue. We want to get the gum line. And of course, before we're done, we always want to get the lips. So when we're doing oral cares, like I said before, you're always checking the integrity of the skin around. You don't want to have any breakdown. And then you also want to check the tube, the integrity of it. Does it look damaged? You're doing these things on a routine basis for the benefit of your patient. So that is how you perform oral cares, and that is why we do oral cares on these patients and why we do them as often as we do. So the next thing that I would like to show you is cuff cares for these patients that are orally intubated. The particular cuff that I have, the only cuffed ET tube that we had in our teaching supply closet was a 5. This is something that you would probably use in a child or a very small adult, but just for the sake of showing you, I went ahead and used this particular ET tube. So when we do cuff pressure check on our patient, at my particular site, they use this little cuff later. Posey is the brand, And so it kind of gives you an idea. So when you hook the pilot balloon right up over here on the side, and then you can kind of watch as the pilot balloon and the cup inflate, and you're able to inflate it to that green, which is where we want to be. Oops, sorry. I'm not looking at it. I'm not doing a very good job. Okay, so here we go. So we're gonna inflate up to where we want to be. We want to be in the green, and there we go. So as you can see, we're in the safe zone here, and you can see that not only is our pilot balloon inflated, but so is our cuff. And you're able to see, you know, okay, we're in the red, just for showing you. You know, if you were to feel that, that is really firm, and that can cause issues to the esophagus, to the trachea. So we want to make sure that we are in fact making good choices and paying attention to cuff pressures. So with this particular device, which is kind of nice, there is a little deflate button that you can push so that you are in the green zone. So there we go. Now I've got us back in the green. Right in the 30s are the, between 20 and 30 is the most ideal pressure, but it is safe all the way up to about 55 or so, 59. And so these are centimeters of water pressure. So that is how you, that's how you check your cuff pressure on those ET tube patients. So that is the end of that video. I'm gonna go ahead and stop here, and then I'll come back and I'll do the BiPAP and the ventilator.